All right, good afternoon. I show 4 o'clock. I'd like to call this July meeting of the Health Committee to order. Looking at roll call, we have members O'Neill, Farley, Bell, and Hanson present. Do we have any appearances by member of the public or county employees?
Chair Byrne, we've had no requests this evening.
All right, thank you very much. Moving on to the consent agenda, we have item 3A, approval of minutes from the June 3rd regular meeting. Recommended approval of bills and transfers, if any, to the county board in the amount of $743,539.18. Can I have a motion? Motion by Farley, second by Hanson. Those in favor?
Aye.
Aye. Those opposed? Motion passes. Moving on to departmental matters. Ms. Diane Hughes, Ms. Lana Sturm from the jail. Anything to report?
We have our report attached. One of the new things I thought we'd share was one of the safety precautions we added for the nurses after incidents. So we have had a barrier put around the nurses' station. It also will help ensure some privacy in HIPAA.
Excellent. Yeah, I saw the pictures of that. It looks bigger than I originally thought, so glad that is in place. Thank you very much. Any questions? Sir?
Not so much a question, but I did appreciate in your report the recognition of the medication-assisted treatment activity tripling and increasing to be able to assist more folks with substance use disorders. I think that's absolutely awesome. It's great work to be able to combat recidivism. So thank you.
Thank you.
Absolutely.
We appreciate you taking note of that. We continue to work and strive to move forward in helping grow that program as well.
Oh, absolutely, absolutely. Thank you very much. Moving on to item 4B, Director McKnight. No items for action today. Senior monthly report. We're discussing vaccines a lot. So anything to highlight in particular?
Nothing to highlight, just that, the Board of Health did not meet in June, so I wanted to give you something. So providing a just spotlight on our vaccination program. Happy to answer any questions if you have them.
Any questions from members of the board? All right, thank you very much. Moving on to item 4C, Mr. Wiley from the nursing home. We have 2 items for action tonight. Looking first at 4C1A, request approval of an agreement with Matrix Care, and I so move. Do I have a second? Oh, excuse me, I'm sorry. May I have a motion, please? Motion by member Hanson, second by member Bell. Care to break this one down for us?
Hi there. This agreement is with Matrix that we already use as our software for our electronic health record and for our receivables. And this is just an add-on where they will help us not only with collections, but more importantly to clean up what has been there for the last several years to help us differentiate what actually has been owed us and what is actually just bookkeeping that needs to get cleaned up. So we anticipate them being able to give us significant help because they are the software company.
Okay. Any questions from members of the board? Those in favor?
Aye.
Aye. Those opposed? Motion passes. Thank you very much. Item 4C1B, request approval of an agreement with Clipboard Health Staffing Agency. May I have a motion? Motion by member Farley, second by member Hanson. Director Wiley.
While we're working hard to eliminate agency staffing utilization, which was down to 2% for the month of May, this particular staffing agency is much more affordable, it's better price pointed, and they provide helpful information about the individual candidate's attendance record. So it'll be a good fit for us.
Excellent. Excellent. Any questions from members of the committee? Those in favor of item 4C1B, please say aye.
Aye.
Those opposed? Motion passes. Thank you very much. How is construction going?
We're in the waiting phase right now, looking for IDPH to come out and recommission the wing that was just worked on. So we've submitted the paperwork, submitted an additional information to them, and now we just wait for them to say they're coming.
All right. Do we anticipate that to be on schedule? As far
We're
as
really
you're aware?
close, yes.
All right. Excellent. All right. Well, thank you very much. Excited to see the finished product. Moving on to JDC, item 4D. We have no items for action today. Mr. Tab, anything to add or highlight in your report?
Nothing to add or highlight. You have my report. If you have any questions, I'd be happy to answer them.
All right, thank you very much. Any questions from members of the committee? Excellent, thank you very much. Moving on, Ms. Taylor, no items for action. Anything to report?
I have nothing to report for this committee. Thank
Okay,
you.
thank you very much. Any questions or items of interest from members of the committee? All right, thank you all very much. Our next meeting is going to be Tuesday, August 5th at 4:00 p.m., and we are adjourned.